Hello guys, welcome back to my channel, and in this video we will discuss about the dental composite used in dentistry. So basically these dental composites are aesthetic material because they are of tooth color, okay. So these composites are tooth color material, okay. So what are dental composites? They are a type of synthetic resin that are used in dentistry as a restorative material, okay. So they are a type of resin which we are using as a restorative material in dentistry, okay. And also they are the mixture of two or more macromolecules which are insoluble with each other, okay. And these dental composites are discovered by Dr. Ray Bowen in 1962 with. So what are the uses of these dental composites? These dental composites are used as a restoration for anterior and posterior tooth. They are used as veneer material. They are used for cementation of orthodontic brackets, and they are used also for pit and feces sealant, and also in making inlays and onlays in dentistry. These dental composites consist of mainly glass filler, resin matrix and coupling agent, and also they contain the hydroquinone, UV absorber, opacifier and color pigment, okay. So these are the composition of the dental composite, as they composed of mainly glass filler, resin matrix and coupling agent, okay. So now we will discuss the classification of the dental composites. So first classification is based on polymerization method, in which we have self-cured, light-cured and dual light-cured. Second classification is based on the size of filler particle, and this classification is given by Phillips, okay. In this we have conventional with 8 to 12 micrometer filler particle size. In small particle, the particle size is 1 to 5 micrometer. In microfill we have 0.04 to 0.4 filler particle size, and in hybrid we have 0.6 to 1.0 micrometer filler particle size, okay. So these are the classification. Now we will see another classification of the dental composite we are using in dentistry. So our third classification of the dental composite we are using in dentistry are based on the generation of the composition of the composite. So here we have 6 generation of the composition, in which we have first generation of composite, second generation of composite, third generation of composite, fourth generation of composite, fifth and sixth generation of composite, okay. So these are the classification based on the generation of the composition of composite, okay. So fourth classification are based on the radio opacity, so they are either radio opaque or not radio opaque, okay. So fifth classification of these dental composite are based on the mode of supply, in which we have two paste system, single paste system, single paste and liquid and disposal capsule, okay. So another classification of these dental composite are given by Graham J. Mount, okay. So according to Graham J. Mount, these dental composite are of three types. Type 1 which is macrofill, type 2 which is microfill, and type 3 which is hybrid, okay. So last classification of these dental composite are based on area used, okay, on which area we are using this composite, okay. So there are two types, which is anterior composite and posterior composite, okay. So this is the first part of the dental composite. In the second part we will discuss more about these dental composite we are using in dentistry. The dental